Hello again, everyone. This is Dr. Mike, and we're back here. We're continuing with our medical exercise training 101 ebook series, and now we're at tip or topic number 13. Now, this one is interesting because I get this question often, and we wanted to make sure we address it. It's a very simple, straightforward answer. And our topic is, what are the liabilities associated with providing medical exercise training services or MET services? There are obvious liabilities anytime you provide MET services to a client. As medical exercise professionals, you must make sure the client is appropriate for exercise. Folks, you just can't take everybody and start them on an exercise program, especially if they have a medical condition. Some people aren't appropriate. This is why one of the first steps with the MET client is to complete a thorough medical history and musculoskeletal screening to make sure the client is appropriate. Folks, just because their doctor told them to come or they decided to come on their own and they're willing to pay you for 50 sessions doesn't mean they are appropriate. You're looking for any red flags that may indicate the client needs a referral back to their doctor, therapist, or chiropractor. There was a list of red flags that we went over in tip number 12. So please, if you would, refer back to that tip because it's important that you make sure you understand what are these red flags. And we went over those red flags in tip number 12. Now, again, anytime you provide exercise services, even to the apparently healthy client, there's some liability if you do what we consider reasonable and prudent. Reasonable and prudent is, one, get a medical history, do the musculoskeletal screening to make sure the client is appropriate. And if at that point there are no red flags, now you proceed on with your assessment. And in that assessment, if you find anything that now indicates a red flag, your obligation is to contact that doctor, therapist, or chiropractor. But please let me continue. Another phrase you should become acquainted with is medically stable. This simply means the client's pain, numbness or tingling, swelling, etc., range of motion, strength, is now under control and he or she is stable enough to begin an exercise program. So medically unstable means the client is having significant pain, swelling, lack of balance, lack of stability. They can't start an exercise program. They need to go back and get more medical care. The medically stable client can tolerate upwards of 30 minutes of even gentle exercise with many breaks, but they have to be at least medically stable. If you find the client still has major medical issues that are not resolved, he or she is not a candidate for medical exercise training. They need further medical evaluation and intervention. The final point with MET liability focuses on the utilization of modalities. The use of any physical therapy modalities is illegal if you're not a licensed physical therapist, physical therapy assistant, chiropractor, occupational therapist, or occupational therapy assistant. If the application of any of these modalities causes harm to a client and you're not licensed, you're then liable, and in some instances, you may face criminal charges or criminal prosecution. So yes, there is liability, but you minimize that by completing a thorough medical history and screening the medical exercise training client to make sure they're appropriate for exercise. Look for red flags. If you find those red flags, identify them. When you find them, communicate with the doctor, therapist, or chiropractor. Obtain a written referral from the client's physician. The written referral, as we said in an earlier segment, always covers you. And lastly, provide only safe and effective medical exercise services. If you do those, you've done what's considered reasonable and prudent, and now you should be okay. But again, the key thing is you can't just charge in and work with any client in any situation. You've got to look for those red flags and determine if the client is appropriate. Don't feel bad if you have to call Dr. Barnes back and say, Dr. Barnes, you sent over Mrs. Jackson and she's not appropriate. I think she needs to go back to physical therapy. Hopefully the doctor will think more of you, the therapist will think more of you, and even the client will think more of you because maybe you made a good call professionally that possibly headed off a problem that could have become a major one for the client. So thanks for watching. Join us again for tip number 14. If you have any questions for me, email me at drmike@postrehab.com, and make sure you look down below to download a copy of the ebook and also look at joining our MedX Pro network. Thanks again.